This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
Instead of saying, I want to win in primary care, that's pretty broad. That's a huge base. What does that look like? Well, what if I instead said, I want to build a primary care program to meet the needs of our Medicare Advantage population and particularly provide well-coordinated care for that population so we can win in that business model? That's very specific. I can figure out if we can do that, can figure out if that's going to differentiate. And if we do that well, it will cascade to other services, other things that we're doing.
Welcome to Sg2 Perspectives. I'm your host, Jayme Zage. Today, I wanted to talk about something that we have been talking about for years, differentiation. My goal is for us to go a little deeper than to say differentiate yourself, that you have to do differentiation. I have Rebecca Limestall and Brian Esser with me, and we'll talk about what differentiation is, what it isn't, and some examples that might help you understand how we move forward with differentiating ourselves. Thank you both for joining me today.
Thank you.
Yeah, thanks, Jayme.
Let's start with laying it out there. What is differentiation and what it isn't?
Differentiation is something that in the business world, you talk about a lot, whether you're talking about peanut butter, retail, clothing, experience opportunities. Differentiation is how the business world works. In the healthcare world, we struggle with differentiation. A lot of health systems and hospitals look and feel the same. It's hard to distinguish which organization you're even interacting with. What we define as differentiation is it must be unique in the market. It has to be known or measurable. It has to matter at the point of time and decision making. A good example I like to use here is you can have a great stroke program, but if you don't have an EMS contract, it's going to be really tough to get those patients in. Then we have the must matter to the consumer, the customer, the one who's making the decision. And that could be the consumer themselves. It could be payers. It could be employers. It could be others who are making those decisions. And then finally, it's not easily duplicated. If somebody else can throw money at it, it's not sustainable in terms of differentiation. We often think about differentiation not in a global sense as much as in micro senses. So how do we differentiate for a particular type of customer? How do we differentiate each individual type of product offering? And there are often options. It's about price, it's about access, it's about comprehensiveness or offering of services. But we have to be thinking about it at the more micro level. How do we make things easy for the customer? How do we bring them in? What is the process we put in place to sustain that differentiation? More so than a building or offering that can be easily duplicated.
I would throw in another stakeholder there, Rebecca. I would also think differentiating yourself with your physician providers that you're trying to recruit as well. Brian, what is your perspective? I know you come from a slightly different lens than Rebecca.
Great summary, Rebecca. What I would add, differentiation when you see it, like you sense like, oh, this is unique here. This is something that I haven't seen in the market yet. And you look at all the classic business cases of Apple, Southwest, Netflix. They showed up differently than their peers and the market reacted in a very positive way. And they were able to gain that competitive edge that they've been able to sustain for multiple years now. But the other side of differentiation is once you become the pace setter within the market, you're going to attract a significant amount of competition, those trying to replicate, those just trying to mimic what's going on to gain any of that market edge or at least steal some of that share. So the differentiators in the market not only can be a one-time thing, you have to infuse into the culture, what do we mean by differentiation from the top down? It can't just be the C-suite and it can't just be those that are in an innovation hub. It has to be the folks on the halls, in the rooms, in the clinics, thinking what can we do that's unique to serve to our consumers, patients first and foremost, but then to physicians that are also stakeholders, to our payers, even to the communities that we're trying to serve. What do we mean by that? And how do we infuse our culture with this mindset of differentiation?
I work with a lot of organizations as they think about differentiation. And the first thing I ask is, let's go outside of healthcare. What is one organization that feels different to you? What is that different? Why does it feel different? It might be something like Amazon, Chick-fil-A. It could be previously Southwest would come up, examples like that. And then I'd go back to healthcare and say, how differentiated are we? And if folks are honest, they will say it's a mixed bag. We have a couple of points that we are differentiated in. Maybe we have a particular subspecialty that somebody else doesn't have. On occasion, I'll get organizations saying it's really our brand that differentiates us. And I push back hard on that concept because brand represents your differentiation. It is the output, the outcome. It's not what you differentiate on the basis of.
It is something that you can't hang your laurels like, oh, we got there and just keep it. You got to keep working at it.
You can extend your differentiation through your brand. You can promote it, but it's not the means by which you can differentiate.
And Rebecca, I would pick on one word you mentioned earlier, the idea that micro dynamics happening in your operating market. Because in healthcare, we don't have these big national platforms like the tech companies might have out there. We have to reflect what is going on in the markets that we're serving and trying to fulfill our mission. And work we've been doing is understanding those markets may vary broadly. It could be a very rural market, could be an urban market, could be commercially rich, could be very governmental, heavy on the payer mix. So differentiation, as you define it as an organization and reflect where you're operating, understanding we may differentiate in this kind of environment. If I'm going to jump from a rural market into a very competitive urban market, what I think is differentiated may not hold up. Understanding as you push to expand your scale and scope, what are you really good at? And does that actually map into new geographies that you're attempting to enter? And if not, that's okay. Just understand where those breaking points might be and what new skills, what new differentiators may need to be added to your bag of tricks to continue to outpace those competitors.
I love that you brought that up. The rural market and the question about does differentiation matter in rural markets comes up a lot. I do a lot of retreats for rural markets. The question often comes up, why are we differentiating? We don't truly have a competitor. There is competition, but the competition looks different. It's not a hospital across town that you might look very similar to. It's differentiating to provide care close to home, and it's providing that care as compared to your destination providers, the next town over or the next nearest. That's who we're competing against. So differentiation is set. It's being able to provide care close to home, and then it's deciding what are the pieces that we do there and how do we connect for the care that we don't do there.
And maybe even differentiating yourself with different partners in the more urban areas in terms of how you get access to more specialty level care. That's a great component of differentiation is you have to know who you're differentiating yourself from. You can be different to be different, but it doesn't get you anywhere if there's not this competitive component to it. And you have to understand that what that is.
The flip side of that is the AMCs. I'll often have an AMC, a children's hospital, a destination program who'll say, of course we're differentiated. We're the only X in our market. And I'll say, great, you have won the market share for that in your market. But what about your tertiary game? If that is your game, if that's who you're saying you are, who are you competing with there? And how do you compare with the other national players or the other regional players, depending on where they're at? And what does that look like? And that's where it becomes a bit more complicated. Well, how do we differentiate compared to them? So I love the idea of who is our competition. And you brought up disruptors earlier. That's another place that we see competition changing. And what does it mean to differentiate as compared to them as well?
Interesting in the discussions I'm hearing, especially amongst the academics, but even the large nonprofits, super regional, national, trying to think about how do we differentiate and is that our strength? A lot of folks are trying to build these innovation hubs and create new businesses, new business models that they can monetize over the next several years, potentially. But the discussion I'm having is some of the AMC saying, we're not going to build this huge AI proprietary IP protected model that's going to get out there. We just want to differentiate within our 50-mile square radius here that we're trying to reach into and say, we're going to keep it local and some of that. And others saying, yeah, innovation's great, but the cash flow on that is highly risky and variable and may not ever materialize. So we'll keep some of that work going on, but there's also general alternative revenue like DME that we can just do pretty well. It's a service we need and the margins are thin, but it cash flows within the next 12 to 18 months. And that's going to help our overall system remain sustainable. So this idea of differentiating on maybe the really cool stuff, but also things that are bread and butter, and you can just do slightly better that makes your operations smoother.
If anyone figures out how to make healthcare truly easy, core services, make them easy for the customer or even for the providers, truly, truly easy, they're going to win a market.
Until everybody catches up. We're talking about differentiating in different context here. And it brings to mind another component of differentiation strategy, which is you cannot differentiate in everything. You have to be selective. Tell me a little bit more about where you're seeing organizations make decisions about what to differentiate in.
There are select organizations who make choices to arrange their business model around points of differentiation, change their entire identity. Kaiser is an excellent example of that, where they play a different ballgame. But for the vast majority of organizations that we work with, we are talking about being very focused on where we want to win. We teach the Play to Win framework here within our Nimble Execution course. I love that framework because it gets us to focus on where do we start to win. Instead of saying, I want to win in primary care, that's pretty broad. That's a huge base. What does that look like? Well, what if I instead said, I want to build a primary care program to meet the needs of our Medicare Advantage population and particularly provide well-coordinated care for that population so we can win in that business model. That's very specific. I can figure out if we can do that, can figure out if that's going to differentiate. And if we do that well, it will cascade to other services, other things that we're doing. But starting there gives us a parameter by which we can measure what we're trying to do. Defining our market as specifically as possible will allow us to design the program in a way that can look different. That is one of the things we've done in the past. We've built huge programs that needed to serve everyone and everything within an X mile radius. And that's not enough to differentiate anymore.
Being very concise in where we're trying to differentiate and not taking these broad primary care, we want to win an ambulatory. Like that's just such a massive word and definition. Like what does that even mean? The one thing I've been noticing is more concerted effort around getting the entire management team up. So from the floors and the clinics up to the C-suite, thinking about differentiation. I've been at a few of these big meetings, 300-400 person meetings where these management crews are finally getting together post-COVID, and we have time to actually step back and understand what we're doing. And the asks of the C-suite saying, hey, we want to hear how we differentiate from you all. Like these big open-ended, give us these ideas. How do you actually operationalize that? So real ideas that are bubbling up at the patient connection point can get into the levels that we can bring that and scale that up across an organization. So being more clear on how do we infuse the funnel of differentiation so we have many stakeholders feeding into that, but then what's the process of testing, piloting, and making sure these are truly differentiators? Maybe they just got lucky, maybe it was an of one, or is this something that we can scale across the region and make a real impact?
That's where differentiation and prioritization often go hand in hand. It's hard to talk about one without the other because when we choose to differentiate, we're making choices about where we want to prioritize, where we want to place our bets, and we're saying some of the other things can ride. We're not making a choice to move forward on those or invest more money in them. Perhaps we keep them rolling, but at a different pace, at a different level than where we're going to aggressively go after the market.
In some of your examples, Rebecca, you've been talking about ways that organizations can differ. You've talked about access, for instance, creating this frictionless experience from the consumer point. Let's talk about quality. Is quality something you can differentiate on?
We're actually digging into more data related to this to see how quality and market share are interrelated. But it's a challenge to differentiate on the basis of quality to the customer. Now, we can talk about some of the other audiences in just a moment. To the customer, it's hard. Patients assume a certain threshold of quality. Patient experience for them is often what they equate to quality. And what's interesting is we've yet to see whether or not certain other elements of quality, like patient-reported outcomes, return to work, if those could make a difference. That's still a bit early to tell, but traditional areas of quality, safety, it's a challenge to be able to say that differentiates for the customer. On the flip side, your workforce, how do you recruit the best workforce? How do you recruit the best physicians? How do you get those payer contracts? I'm going to ask Brian to weigh in. How does quality factor in?
Similar to how you're trying to correlate quality to market share, we're trying to see, does high quality equate to payer contracts that might have higher rates, or at least reflect the investment that you as an organization are putting into delivering high quality care across all of your sites and service lines? And we're looking at how do we blend price transparency data that's available in the market to our assets like the clinical database to see what does that trade-off look like if there is one, and how do we correlate that and begin to bring those messages back to the payers at the negotiating table, infusing quality messages messaging, all the strategy and insights that we try to deliver within SG2, operational insights, consumer feedback, to really develop a narrative for the payers that prove essentiality for you as an organization. It has to be not just rooted in one of those domains. It has to be a cross-functional story that says, here's who we are as an organization and what we feel the rates we're asking for are justified based on the delivery of care that we're offering to the community. So it really has to be infused across that. But does quality by itself receive the rates and all that attention? Hard to say.
I'm going to spin it a little bit because if we think about the quality of a medical device, so if we think in the medical device industry, quality in the outcomes that are created can be a differentiator. And we work with a lot of our life sciences and industry partners, and those who have premium pricing are looking to quality to justify higher prices in their products. And in some cases it works, in some cases it doesn't. It's not just quality. There's got to be some other components as well in terms of total cost of care and overall value, ease of use, impact on the workforce. Those kinds of things also come into play in terms of the quality, but certainly things like complication rates and length of stay and readmission rates and those types of things come into play for the medical device industry in terms of being able to differentiate themselves in the market in a way that they can get that premium pricing.
As we've seen more organizations shifting and just the aging of the population, we have more and more lives tied to contracts with Medicare and Medicaid, so governmental payers, which we all know from a payment dynamic is less. And in that vein, if the quality coincides with a shift towards value-based care and understanding our quality is not just delivering quality because that's what we want to do, but we also feel that can impact access and cost and help us win in an alternative payment model design like shared savings or others, then the quality discussion becomes much more interesting, why we're focused on this and what the impact is going to be both on a quality and a value and a payment basis will grow in importance, it feels, over the next several years.
We're always action oriented here. What can our listeners do to start to move towards differentiation or to enhance their differentiation strategy? What's the first steps they should take?
The first step is being honest within the organization, within the executive team, within the strategy teams of, are we truly differentiated? Does that matter to us for the future? Where does that rank on our list of priorities? We recently did some work on two types of strategic plans, one being very focused on prioritization, the other being all about differentiation. If you're an organization that is actively pursuing differentiation as your strategic priority, focusing the communication on that. We will say yes to some things. We will say no to some things. This is how we show up. This is how we move forward. And with that, being very clear in the communication of what does differentiation mean? Who are we trying to succeed against? Who is it we're trying to design programs for? And how will we know if we're successful? So it requires a lot of change management to get to that level of differentiation. And it starts with being honest about how differentiated are we and compared to whom.
Differentiation is a discussion we need to be having today because on the flip side of this discussion is the naysayers. The other stakeholders are saying health systems across the country have not pushed the envelope hard enough. And think about our employers are saying our costs are rising. I'm not seeing anything really improving other than that. Like, help me understand that. Or those saying, hey, nonprofit, tax exempt, are you still delivering on what that really means? We have those in the sideline chirping of how does this really justify? Are you justifying some of these benefits that you're receiving? So if we don't force ourselves to differentiate, think in a much more nimble fashion of how we prove that we're really hearing this feedback, this criticism, and reinventing ourselves, we do risk the narrative getting away from us as well. So we need to understand there is this flywheel effect. If we can continue to differentiate and show improvement, that's going to give a positive boon and message to take back to the market.
The one thing I would add to what both of you have said is you need to define why are we trying to differentiate? What is our strategic goal that we're trying to achieve that we think being differentiated will help us get to? And a lot of the elements, Rebecca, that you were talking about and you, Brian, will start to crystallize. And that becomes almost your guiding light for what you're making your decisions on about differentiation. Well, that's all we have time for today. And Rebecca and Brian, I am so grateful for you to join me in the discussion today. It's been great. I always love debating with Rebecca and Brian some of these fun topics. Thank you all to our listeners for your attention today. I would love to have you again on Sg2 Perspectives.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You could find them at Vizient /podcasts. Have a great day.